The CDC officially reported that Belize is the 43rd country to reportedly have Zika. Locally, though, the Ministry of Health has not confirmed any cases as yet. But whether confirmation of Zika in Belize happens in the near future or later in the year, it is everywhere else around us. This makes it a critical time for Belizeans to start thinking about prevention.
The message from the Ministry of Health to the communities is prevention. So just as a reminder, we have the mosquito in country, and the mosquito, the Aedes aegypti, is the one that causes dengue, chikungunya, and Zika virus. And a reminder that 80% of the cases of Zika are asymptomatic. Only 20% will have symptoms. The most common symptoms, more than 60%, the number one is the rash. And the rash is described as maculopapular. And this is 96% of the cases. The rest of symptoms that are more than 50% are headache, arthralgia, and conjunctivitis. And then less than 50%, as low as 36%, have fever.
The mildness of the symptoms means that people can have Zika and not even know it. Since only 1 out of 3 will develop a fever as a result of Zika, the symptoms to look out for would be a rash and possible itch. It may be accompanied by pink eye or joint pain. Zika can also be transmitted sexually, which means an infected mosquito may infect a male and the virus becomes present in his semen. Any unprotected sex with a woman can infect that woman, and if she's pregnant, it can be passed on to her unborn child.
If you're not planning to become pregnant, just use a condom. For women that are planning to become pregnant, the advice is if the partner or her travel to an area with active Zika virus transmission, they should wait at least 8 weeks using condom every time they have sex, or during this 8 weeks have no sex, to reduce the risk, the potential risk of transmitting the virus if either, especially the man, the sexually transmitted transmission is from male to female. So if the male is asymptomatic and she gets pregnant within this window period of 8 weeks, then there is a greater risk of contracting the virus.
It is hoped that couples will understand the urgent need to take precaution, since the link has been established that getting infected by Zika at any point in your pregnancy can cause severe birth defects.
We define microcephaly as infant's head being smaller than a normal infant without microcephaly for age and sex. And we have a WHO chart that we use for children at term, and we have a next chart that we use for preterm babies. So you have that available. It's not only the size of the head, but the damage that it causes to the tissue in the brains, up to even calcification of the brain.
What does that mean?
So that means that the brain cannot function normal if that child were to survive. But that can be detected because not all cases of microcephaly will end up with calcification. But you need to document that, investigate it before through ultrasounds. So we recommend at 20 weeks and then at 29, and then do a comparison to see if there is any reduction in the size of the head of the fetus and if there is any changes.
So you can tell that from an ultrasound?
From an ultrasound, suggesting that there are changes to the brain tissue. The recommendations during pregnancy is that the woman needs to come to us before, as early as she knows that she's pregnant. Once she misses one period, that's enough to come in and say, well, let's see if I'm pregnant, and then we start the process of education and providing other services. There's recommendations during pregnancy is to avoid to be bitten by mosquitoes. And for that, we have that we need to do weekly elimination of the breeding sites around the house. Yeah. It's not a one time, it's every week. Make sure we don't have none of the potential breeding sites, they're active. Use clothing to reduce the exposure to be bitten by a mosquito. Use repellent. Not all repellents are good for pregnant women, so they have to make sure that they use the one that is recommended by CDC, for example. Use screens in the home to reduce the entry of the mosquitoes. Use bed nets, not only in the night, but during the day. So if you want to take a nap during the day, you have to be with bed net. Avoid traveling to areas. If we confirm a first case, then it would be traveling to areas known to have the active transmission of the virus or abroad. We definitely have to avoid those traveling if we can, if the woman can. That's the first measurement to avoid the mosquito bite. The second one is to protect against the transmission. So she's already pregnant, and if there are identified cases in Belize, documented, or if the husband traveled abroad, then, or even if none of those are present, it is recommendable that the pregnant woman use a condom every time she has sex, or just not have sex until the end of the pregnancy.
Dr. Beer says that only 1 to 2% of pregnant women infected with Zika will be at risk of having a child with birth defects. Even though not all babies of Zika-infected moms will be born with microcephaly, it is just not worth the risk.
Countries have come to realize that women and couples and families have right to make their own decisions. Of course, if you know that there is a dreadful situation, one would try to make as much as possible all the precaution measures to avoid complication, in this case, the fetus. So, as I mentioned before, if you are not rushing to have a child, we have how to help you. There is no treatment for Zika. So prevention is the only response that we can implement in country to reduce the number of cases or the potential cases of Zika.